Welcome to Sugar River Family Practice. I'm your host, Elizabeth D'Orazio, and I'm joined by Dr. Black's CMA, Tanya Peck. And she came to this practice because she liked its patient-centered approach. We're going to hear her reasons why this is the best place for your family to come. Tanya, thank you so much for joining us.
Thank you for having me.
Anytime. Now, we've had the wonderful opportunity to speak to Dr. Black and hear his philosophy of practice. What attracted you to assisting him in this unique approach to healthcare?
I think the thing that I like most about it and what brought me here was that it was a smaller practice. And at this point, it's Dr. Black and myself. And it gives you a chance to actually get to know the patients. I've worked in other settings previously throughout my 15 years of doing this, and it's very difficult to get to know your patients when you have so many to see in a day. And so we do longer appointments here, which gives us a chance to talk to the patients, to really get to know them. So when a patient calls, I actually know who that patient is. I know I have a face to put to it. I have a whole story. I know exactly what they're calling for. So it's really nice to be able to actually know who's calling and have that connection with your patients, which I don't think you get in a lot of places. So
it's really a medical relationship based on that friendship and trust first and primary.
Mm-hmm. Absolutely, absolutely.
And as is, anytime we go to the doctors, we get nervous.
Right.
And inevitably you get in the car and you remember, I forgot something. It's so much easier, a little bit longer time, friendly face, can call you, talk to you personally.
Yep, I do. I take a lot of the phone calls here as far as patient questions, medication refills. So I talk to the patients a lot on the phone as well. And when they come to the office, of course, I see them before Dr. Black does. And so I have a lot of contact with them in terms of that. And so a lot of their questions and their requests come through me initially first in the office. So we do like to have that amount of time. It does take time to get to know your patients, and you want to have a full picture of what's going on with them, what their needs are, and that takes time to do. So that's the big reason for the longer appointments.
So if we were to come to this practice, kind of give us an experience of what it would be like for us to come and do the onboarding with you.
Coming on as a new patient? Yep. Initially what we do is a new patient appointment. So at that appointment they would come in and bring any information that they need as far as medications or pertinent health information that they think we need to know. And basically I do a basic workup, obviously vital signs, things like that, the normal stuff you would do at an appointment. And we just take in a lot of their information. Dr. Black will meet with them and sit down and go over their medical history, what their needs are, what medical needs they have, and even if they don't, even if you don't have a diagnosis, it's still important to be followed by primary care just so we can maintain, healthy living and all of that. So it's not always if you're sick or that you have a medical condition. It's just the whole point of your overall health in general. So,
and that's something Dr. Black and I were discussing, is it's very easy in our busy day and age to just treat the symptom,
Yes.
Quick, take a pill, put a Band-Aid on it, but really that doesn't get to the underlying cause.
Right, and that's a big part of it. So that's fortunately one of the things that we get to do here is we have the time, and that's why we do it this way. So we have the time to find out instead of just saying, oh, you don't feel well, take this pill. We don't do that. We get the big picture of what the person actually needs, and it's not always medication. So it's nice to have that time to be able to look into that.
And there's also not just if something's wrong, but just looking toward optimal health. Every year spring comes around and we realize, okay, we've had cabin fever, maybe we need to be a little more active.
Absolutely.
Perhaps having someone like yourself helps us reach a higher level of health in our own life.
Yeah, it's very important. People tend to think if I'm not sick, I don't need to go to the doctors, but that's not necessarily true. We do like to maintain things and do normal screenings, but it is important to look at everything that you can be doing, and there's always something. Everybody can do something to be a little bit healthier. No matter what your health level is at, you can always do something. So we try to focus on that here. Very much so.
Well, I can tell you, you're very easy to talk to. So it's going to be very easy for you to come and see CMA Tanya Peck, who assists Dr. Black in his practice, and do that springtime checkup. Or maybe you have an optimal health goal that perhaps you're trying to pursue. The people here at Sugar River Family Practice could just be your new home. Picking that perfect local professional to help with that home improvement project has never been easier. When we return, we will go to the Home Life Expo and meet another great resource.